Doctors at Memorial Sloan Kettering Cancer Center have helped pioneer the development of an approach called immunotherapy. One woman's experience with it showcases its effectiveness.
When they found the mole and said it was melanoma, that's scary. They got it early, they removed everything was great.
But 1 year later, Karen's cancer was back.
I felt something. It was in the soft tissue of the lymph node. Again, went in, did surgery, removed lymph nodes all up and down my leg, checked everything. There was melanoma in the soft tissue, removed everything, and at that point, you are considered NED, which is no evidence of disease.
But Karen then had a routine CAT scan, which showed the cancer had metastasized and spread to other parts of her body.
We actually had the CT scan 2 months before it was due, just because it was beginning of summer, wanted to go enjoy it, and we were lucky that we did because the findings said that there were 12 tumors at least in each lung.
And I can remember we were sitting in this room right here when she told Matt and I, and just was devastated after thinking we beat it already, and then to just have this thing thrown back at us.
Metastatic melanoma has traditionally been considered to be a very difficult disease to control.
Radiation doesn't really work on melanoma. Chemotherapy is not the best. There wasn't a lot of options.
We offered her the opportunity to consider a clinical trial.
So really the trial was the best bet.
Karen was on her way to the forefront of research into 2 immunotherapy drugs used together. Each of the 2 showed promise. The combination of the 2 would pack the 1-2 punch she needed.
We have been investigating immunotherapies that are called checkpoint blocking antibodies for almost 10 years now. These are medicines that allow the immune system to, if you will, run past where its brakes would normally stop it from reacting. We had been working with one of these medicines called ipilimumab, which was approved by the FDA in 2011 for melanoma, and some of the pivotal studies leading to that approval were done here. A next medicine called nivolumab, which blocks another one of these molecular brakes that the immune system uses, also helps about 30 to 40% of people with melanoma. We, along with some colleagues, theorized that you could use these 2 medicines together. And in an early clinical trial that we reported about 2 years ago, we showed that more than half of patients with advanced melanoma were having very significant responses to that combination.
That was a small phase 1 trial which Karen participated in. That led to a larger phase 2 study to further evaluate the combined effectiveness of these treatments. In phase 3, 945 patients from around the world were enrolled at 137 different locations. 57% of the patients with melanoma showed a major decrease in their cancer. It was the combination of drugs which worked for Karen.
The trial saved my life. Each time they do a scan, the tumors dissolved more and more and more. There is no evidence. The tumors are gone, all of them. You know, they never like to use the cure word, and I don't like to say that either, just because it's risky. But there is nothing left in me.
Karen kept her hopes up and never stopped believing.
This is perfect for Karen. You know, she's like that. She's a pioneer. Wasn't gonna, because it's new, it wasn't gonna prevent her from, succeeding with it.
Using your own body to fight cancer cells is pretty incredible.
Immunotherapy is no longer an experimental approach. It has now reached the point where it is a conventional approach to treat cancer. There's really nothing more satisfying for me than to see a patient who has been returned to a state of health that is so satisfactory. The risk is not gone that this could come back, but that she has really made such tremendous progress that has been sustained now for almost 2 years. And that she has been part of an important research program. I thank her every time I see her for volunteering to be part of moving the needle forward. We would never make progress in cancer research without courageous patients volunteering for clinical trials.
Karen had an amazing support system consisting of a circle of friends and, of course, family. You saw one of her girlfriends there on the video along for one of her treatment days. Karen and her entire family really pleased with the treatment at Memorial Sloan Kettering and her promising new outlook.